In blockaded Nagorno-Karabakh, deaths and health problems are on the rise due to essential supply shortages. Among the 120,000 Armenians who have been living under Azerbaijani blockade for more than 7 months, 30,000 are children. Today, they are among those most vulnerable to the effects of Azerbaijan's blockade. No food, medicine, or other essential supplies have entered the region in weeks, as Azerbaijan continues to illegally obstruct the Red Cross's work on the Lachin corridor. Now, with food and essential medicines in scarce supply are completely gone, health problems for the civilian population are materializing. Pediatricians say that children are already exhibiting symptoms of vitamin deficiency, with nutrient-rich foods like fruit, vegetables, and meat scarce or completely gone from stores. Young Lusa is one of those children. After a doctor's visit, her mother found out the child's hemoglobin level is low as a result of malnutrition. However, vitamins that can supplement foods missing from her diet have almost run out from pharmacies, as have stocks of medicines. With fuel in scarce supply and public transportation unavailable, her 10-year-old uncle Tigran hitchhiked his way to Bertashan village in Martuni region to bring Lusa berries, pumpkins he had grown, and sugar and cooking oil he had received in the past with a rationing ticket. Meanwhile, Nagorno-Karabakh residents even younger than Lusa are now facing the consequences of Azerbaijan's total humanitarian blockade. Last week, Liana Voskanyan, a mother of 6 living under blockade in Karabakh, told CivilNet that if pharmacies are not stocked with formula milk in a matter of days, her baby will be left without food. Fruits and vegetables she could use to make supplemental food have also run out. The youngest of her 6 children, 5-month-old Avetis, was born during Azerbaijan's blockade.
Since we were under blockade when Avedis was born, I knew there might be a lack of formula. I contacted breastfeeding specialists in Armenia so that I could breastfeed Avedis. But after 2 months of trying, it didn't work, and we had to switch to formula milk. I openly declare that if humanitarian aid does not enter Artsakh in the coming days, my children will know what starvation is. Nothing will be left.
Issues for other vulnerable populations in Nagorno-Karabakh have also come to fruition, with the number of early-stage miscarriages having nearly tripled. According to the head doctor at Stepanakert Center for Maternal and Child Health Care, the surge in miscarriages can be attributed to high levels of stress among pregnant women and their inability to access a balanced diet amid Azerbaijan's blockade. Meanwhile, with essential foods and supplies quickly depleting, even acquiring bread has become a challenge for families. Long lines for bread are forming outside of shops and bakeries. On the one hand, bakeries are unable to deliver to shops due to a lack of fuel and transportation. On the other hand, rolling electricity blackouts amid a deepening energy crisis are burdening bakeries and making it difficult to bake enough bread to feed the population. However, although children have become a victim of Azerbaijan's blockade, many of them are also emerging as local heroes. In response to the growing bread lines, a group of 120 teenage volunteers have mobilized, taking turns to deliver bread from bakeries to shops in Stepanakert by foot. 10 to 15 of these young people deliver bread by foot every day, reaching even the outskirts of the city. Since mid-June, Azerbaijan has blocked all goods from entering Nagorno-Karabakh, pushing many of the region's 120,000 Armenians to the brink of starvation.